detection of carriers among the staff and patients, typing of isolates from patients and hospital environment to find out the source of infection. Various typing systems used are fast typing, bacterium typing, antibiogram or registogram, biotyping, serotyping, plasmid profile, etc. Now the most important part where your role is coming into play, prevention. How to prevent hospital acquired infection. Education of medical and nursing staff regarding the basic concepts of infection control. This is very important. Unless you are aware how you will control hospital acquired infection. Aseptic and antiseptic procedures during surgery and after surgery, post-operative care, good surgical techniques, early recognition and isolation of infected cases, overcrowding of patients or the mingling of susceptibles and spreaders in a ward should be avoided. This is a very debatable area because every time I find that someone is coming to me, sir, please give me permission, I want to be with my patient, sister is not allowing, isn't it? It's a very common problem. Carriers among the patients and staff should be detected and treated accordingly. Protection of highly susceptible patients, that is premature babies, immunocompromised individuals, etc. Asepsis in theatre, hygiene in wards and kitchens, and special attention to the disposal of excreta, solid dressings, etc. Proper sterilization and disinfection of inanimate objects and use of disinfectants in the hospital environment help to control the source or reservoir of infection. Provision of sterile instruments, dressing, surgical drops, etc. And use of disposable items such as syringes, catheters, tubing, etc. Bacterial interference, it is colonization of newborn with commensal microorganisms to prevent the colonization of carriage sites by more virulent or antibiotic resistant strains. Can you give example of this bacterial interference? Please see. I am repeating, it is colonization of newborn with commensal microorganisms to prevent colonization of carriage sites by more virulent or antibiotic resistant strains. It is similar to zero dose of polio or something like that, where we are giving bacteria which are attenuated, giving virus which are attenuated strain, passive, which are actually which will colonize in the gut and will give local immunity and will not allow the virulent polio virus to interfere. So that is the philosophy of this type of bacterial interference. That is replacement of the virulent strain with the commensal organism. Then prophylactic antibiotic therapy in specific situations for short period, that is before surgical technique. Limitation of use of antibiotics and rational use of antibiotics as per antibiotic policy. Other important precautions, frequent hand washing, very, very important. Then limitation of transfusion, frequent change of intravenous lines, frequent change of working clothes, staff suffering from infection, that is infected lesions, respiratory infections should not be allowed to attend the patient. This is also very important. If the nursing personnel or the attendant or the dresser, if themselves are affected, they should not be allowed to attend the patient because there may be transmission of the disease. Because hospital acquired infection is a two-way system. From the patient to the staff and from staff to patient. So anyway it can occur. Each hospital should have an effective hospital infection control team, HICT, consisting of microbiologists, medical and nursing staff, hospital administrator and clinician. In our hospital we have the team, but I think recently the activity is not that good. Shikha will agree with me, because I am now very busy with the day-to-day administration. I am not finding the time. So, but please continue with the good work, even if I am not, because now I am not finding time to visit all the wards every day. But please continue, so that the good work is continued, it not disrupted. What are the function of hospital infection control team? Investigation of the infection, control of outbreak, guidelines for admission, nursing and treatment, surveillance on sterilization and disinfection practices, education of personnel, staff working in the hospital and patients, monitoring of hygiene practices. Role of microbiologists, very important, diagnosis and susceptibility testing of organism, surveillance of infection, notification of outbreaks, investigation of source, surveillance of health of persons working in hospital, guidelines to control infection, timely reporting of laboratory data relevant to infection. Now, after I have finished the basics of hospital acquired infection. Now, I will tell one of the aspects of nursing administration.